Today is day 20 of the government shutdown. Joining us right now to take a look at the week ahead in the Senate is Senator Bill Cassidy. He chairs the Health, Education, Labor, and Pension Committee. And Senator, thank you for being here today. Day 20 of the shutdown, and people are pointing out, the Wall Street Journal and others, that as of November 1st, things could get a little more pressure. If this lasts another 12 days, people will start to see what it means for their health care subsidies in the ACA. Where do we stand right now? What breaks this? How do we get back to business? What's going to be the thing that kicks this off?
As a former emergency room doctor.
Right.
A gastroenterologist.
You didn't work in an emergency room?
Well, I did,
you
but
did.
You know, more my
You're a gastro guy?
Gastro guy.
Oh, hang out at, yeah, hang out at. I want to talk to you after the show. Okay.
So Schumer could open this up tomorrow.
Yeah.
And it's a little bit of a catch-22.
Will he?
Oh, I don't know that.
Yeah.
Now that they've had their No Kings event, he's been able to show that he's hanging tough for the far left. But that said, all we ask is that you continue the current budget written under the Biden administration so that we can negotiate. The catch-22 is that the people we need to help write the legislation are furloughed during the shutdown, so we cannot write the legislation to address anything because they're furloughed.
Wow. Kevin McCarthy earlier said this shutdown's a little different than others. There's not necessarily a pressure point or something that makes this make sense.
I would say that the pressure point is that health care premiums are going up for people on the Obamacare exchanges and in the business world. Mm-hmm. They're going up 20% for people, for the small businesses. They're going up 30% for the people on the exchanges. What Democrats are proposing doesn't lower the cost of health care.
Yeah.
It papers it over with subsidies for those on the exchanges, does nothing for the small business owner who's trying to afford to provide health care for his or her employees. And it does nothing for the employee. Republicans are proposing that we actually decrease the cost of health care, not just for the exchanges, but also for that person who my gosh, my wages aren't going up because more is going to health care. Let's fix it for them too.
How do you get to there? Because that's a long, kind of onerous conversation when you have two sides that don't see eye to eye on something like this. It's got to be fixed, and it's got to be fixed pretty quickly.
So, Becky, the ironic thing is, I'm not negotiating on CNBC, but there are things that Republicans and Democrats have previously agreed upon.
And what are those?
For example, we had a package that passed almost passed the Congress last December, but was agreed upon on a bipartisan basis to address PBMs, PBM reform.
Yeah, pharmacy benefits managers.
Yeah, pharmacy benefit managers. That would have lowered the cost of drugs for the small business owner who's buying insurance for his or her employees, would have lowered the cost of that policy for he or she. It would also have lowered the Part D premium for people on Medicare. So these are things that we've agreed to. Now, I'm not saying that, oh my gosh, if we did this, we would reopen the government.
Yeah.
But it also included price transparency. Price transparency, if someone could see the price, then you could begin to see decreasing cost, not just decreasing premiums.
We have had talks about this for, it feels like decades at this point, for some of these ideas that just never seem to get passed, never seem to get taken seriously, and never make it to the finish line on some of these issues. What happens in your state? Because in Louisiana, I think the marketplace enrollment in Louisiana more than tripled over the last 5 years, leading up to 2025. People are definitely taking advantage of it there. Your uninsured rate in the state went from 16.6% in 2013 to 6.9% in 2022 because Louisiana, under the Affordable Health Care Act, did expand its Medicaid program pretty extensively. So what do you hear from your constituents? What do you think needs to be done again as a doctor, too?
Yeah, believe me, I'm always approaching this. I was a physician who worked in the hospital for the uninsured and the underinsured.
Yeah.
But let me point out, price transparency, we've actually made progress.
Okay.
So under the first Trump administration, when we passed the No Surprises Act, which is a bill I authored, co-sponsored with Senator Hassan from New Hampshire, we passed the No Surprises Act that began to introduce price transparency. The Trump administration doubled down on that. The Biden administration has advanced it. We could advance that more and increase the power. Meaning
I know what a test is going to cost me before I get the test. I know what it's going to cost to get an MRI at one hospital versus an outpatient facility?
Absolutely.
Yeah.
And as it turns out, the cash price for an MRI may be $600, and then the price in the hospital may be $3,000. If you have a health savings account, that makes a big difference. Yeah. Now, going back to my state, my lovely state, If we say about Louisiana, people in the in the Obamacare exchanges who are at the upper end of income, they're paying through the teeth. They really are paying too much. And so and the small businesses, they're also paying too much. Wage growth is stagnant because workers are having to put more of their income into paying for health care premiums. That's why Republicans are about lowering the cost of health care actually.
But what's going to happen in 2 months if these subsidies are not extended? What happens in your state?
Oh, in the Obamacare exchanges, if the subsidies are not extended, there'll be a modest increase in the increase. But even without, even with the subsidies, you're going to see 20%, 25% increases because Obamacare has become the Unaffordable Care Act. And what Democrats are proposing does not lower the actual cost of health care. It papers it over for the exchanges with about $26 to $40 billion worth of subsidies.
Yeah. So are you a no on extending this no matter what happens, even if there's talks among the leadership, you're voting no for this?
No, show me the deal.
Yeah.
Show me the deal. Because, again, I'm a doc. I want people to have insurance, but I want that insurance to be affordable. And it also has to be affordable for the taxpayer. And so if we can put that together by actually lowering the cost of health care, it's a win for everybody.
How long would it take to work out a deal like that?
Well, like I say, the crazy thing is we have previously agreed upon legislation, which, yes, it has to be updated. But if you update it, and you need the people back in the government so they can help update it, would, according to a previous CBO, one of the things that has been previously agreed to would lower premiums by 11%. No, that's real. And this has been previously agreed to on a bipartisan basis. It's kind of like, I mean, you're just sitting there pulling your hair out saying, if you want to reopen the government, pay the troops, pay your air traffic controller, pay everybody who's frontline, in fact, pay everybody who's working for the government.
Right. You have a bill that you've put together in the past to do just that the essential workers still get paid during government shutdown.
And Ron Johnson is running the bill now, and I'm a co-sponsor. Let's get the essential workers, but let's get government back open. And I say that Schumer could do that like that.
I guess there's a certain school of thought, Senator, that health care for people that can't afford it is going to cost the government money. Your point, I guess, is that we should try to hold down costs as much as we can because we have problem. We have a spending problem. We should find a way to do it, but do it in a cost-effective way, if at all possible. That's where the Democrats conflate what I think Republicans want, and I think they're saying that Republicans want to leave people high and dry.
No, we actually don't. And I would argue that what Democrats are doing is for that small business owner whose premiums are going up 20%, passing it down to the employee. Republicans want to lower the cost of health care for them, too.
Do you think it's 1 point? I mean, they do have some crazy stuff in the 1.5 trillion. Would they sign on for 345 billion, just the extension for the subsidy? Have you heard that? Because I know that Mike Lawler went up to Leader Jeffries and said, here's a 1-year extension of that. Can we talk about this? And just started berating him about, being a Donald Trump crony or something. Would they accept just a clean extension like that?
Since I think they're being so irrational now, I do not pretend to know what they would do.
Okay.
Because what I'm speaking of is being rational, that reopens the government, that begins the process of lowering health care costs.
Do you want to make sure that there's no, and we've talked about, Republicans say we're covering illegal immigrants. They're not making federal funds available to illegals, but because it's fungible, there are back channel ways in these
well, the state can expand.
Where the state expand. In California, everybody, if you're illegal, you are covered on state Medicaid. Full focus Medicaid, and they pay for it with state dollars, but they have extra federal dollars to cover the stuff that they would have been using the state dollars for. So it effectively is federal funds going to illegal immigrants.
It effectively is, Joe.
Yeah.
And that's what Democrats have said that they want. I would argue.
And they want by removing provisions of the big beautiful bill, which tried to rein that in.
And I'll also say that some of what the one big beautiful bill did is it banned using federal funds for sex change operations for minors.
Right.
Now, these are the sorts of things that they would bring back in. I think we should be focused on how do we lower the cost of health care, because that's going to benefit the small business owner and the people who